Hi, I'm Dr. Naugher, shoulder and sports medicine surgeon with TSAOG Orthopaedics and Spine. This video is about ACL surgery. Specifically, we've decided on doing an ACL surgery and what to expect between the date of the visit where we discuss it and what's going to happen leading up to and the plan for surgery itself. So in that clinic visit, we will decide about the operation and we'll leave that room and we'll go out to the desk and meet with my surgical coordinator who will take over and help assist with getting things lined up. Specifically, she's going to talk with you at that first clinic visit about possibly booking a date for surgery. And that's usually within a few weeks or longer if needed. She's going to help arrange a therapy plan, either for therapy before surgery or after. We'll also update your pharmacies so that we know where to send your medications after the surgery itself. Now, in some cases, if you need to have preoperative labs or tests, we'll get those arranged, but not everybody, especially our young athletes, may not need those tests. We will also review other injuries in the knee, whether meniscus or other issues have arisen, and a plan for surgery itself. And specifically in this video, I will remind you about the options for a graft. When we perform ACL surgery, typically we're reconstructing an ACL or giving you a new ACL. In rare cases, we're able to repair the ACL, but those cases are fairly few and far between. Now, in that clinic visit, we'll talk about the graft options, either allograft, which means cadaver, tendons from a different person, or using autograft, which are your own tendons. Typically, we will recommend use of quadriceps tendon autograft, the tendon above the kneecap. In some cases, especially in revision settings, we may also review other graft options, including bone from your patella and the patellar tendon or hamstring tendons. But just to bring this up, this is something that over the first few weeks, if a decision wasn't already made, be thinking about it. Now, once you leave the clinic and suppose we've picked a date, there are a few things that we want you to do to get ready for surgery itself. Number one, activity. How active can you be? In some cases, we will actually prescribe physical therapy. We will refer you to one of our therapy offices to do what we call prehab or pre-rehabilitation. The goal of this is to actually restore motion, function, gait. We want you to look as normal for a lot of ACL injuries as possible. We want you to be walking normally, no limp. We want your swelling to be minimal. We want your motion to be close to normal. The goal of this is so that if you look normal before, you'll restore these parameters. We'll get you walking with better motion immediately after surgery or as soon as possible. I would advise that if you are undergoing an ACL surgery or have been diagnosed with this injury, I would not recommend you continue running or playing sports. Now that may seem common sense, and I think it probably is, but I would reiterate that you should take it easy because there is possibilities doing those types of activities of sustaining additional injuries that might change your surgery or need to alter the plan. The next step is to prepare your home for surgery and getting ready and what to do to be ready for the surgery itself. Again, as we just stated, plan to stay active, plan to continue walking, moving, and keeping the motion and strength you do have. But at home, I would be prepared for a few different things. Number one, a sleeping plan. Assess your home and you know whether you're going to be upstairs or down. If you are upstairs, do you have the option, either a bedroom downstairs that may be easier for a week or two? With ACL surgery and most knee surgery requiring the repair or reconstruction of ligaments, you will still be able to get up and down stairs, but it will be difficult. I will tell you that sleep at night is difficult after knee surgeries. And this is true for most folks, no matter how much medicine you take. So have a plan in place to use your medicines and use ice at night, and that should help get you through those first few days when it tends to be the worst. Also, be prepared to possibly modify your bathroom plan, either toilet or showering. We will allow you to get up and down from a toilet seat. It may be difficult if your post-operative instructions require that you do not put weight on your knee. So you may need to have a plan to be at a restroom or a bathroom with good hand support so you can get yourself up and down easier. Also, shower. We will allow you to shower starting on the first day after surgery. We will allow you to take the big dressings down and allow water to run over your incisions, but we will ask that you don't soak your incisions. Do not plan to be in a bathtub, a hot tub, or any body of water where your incisions could be soaked and allow water to seep in. Now also at home, just some basic safety checks. Some folks after surgery, we will require that you use crutches. If you have meniscus damage or some types of ligament injuries or cartilage damage, we will tell you that you are not allowed to walk on your knee, and that will require full-time use of crutches. And you may need to just plan for space between rooms or pathways around your home to be safe. Look out for slip hazards, rugs, and steps that could catch your crutches or your leg while you're moving about as well. And finally, at home, I would just tell you to be prepared and have set up a comfortable chair or station for daytime use. Typically what I mean by that is a location where you can post up for the day, you've done your exercises, and now it's time for rest. Have a phone charger nearby, have your icing equipment, whether it's a machine or Ziploc bags, water, any other equipment you might need, as well a good book, the TV remote, your phone to help pass the time. And finally, along with that, in your station, at the spot where you're going to be spending a lot of your time, have that ice plan in place, whether it's Ziplocs or gel packs with frozen packs or the cooling machine. Have a plan for icing, which is very effective, especially those first 3 to 5 days after ACL surgery. Now to talk about the plan for therapy. Everyone after knee surgery, and especially after ligament and ACL surgery, will need physical therapy after the procedure itself. Usually we will have that first visit for after surgery already set up. In a lot of cases, that'll be the day after surgery, and that's fine. Usually the first follow-up or the first visit for therapy after surgery is an evaluation where the therapist meets you. They assess your knee, they look at your wounds, they can help ice you down and lay out a plan for therapy. They may do a few basic exercises, but that first visit, even if it's the day after surgery, is safe to go to. That's a common question I get is, they've scheduled me already for tomorrow, is that okay? Another thing about therapy is they will help guide you on how to put weight on your leg. Folks that have isolated ACL tears, whether you use allograft, tendon, or autograft, a lot of those folks, we will allow you to put full weight on your knee as tolerated, we'll say, which really means when you feel ready. If we use your tendon or your quad tendon, it may be difficult to put weight on it for the first week or two, and that's fine. The therapists will help guide you on how to use your brace and how to use your crutches appropriately until you're ready to start putting weight on your own. Typically, for ACL injuries, we're going to want you doing therapy for at least the first 2 to 3 months, sometimes longer. We'll also talk about long-term therapy plans for my younger athletes or athletes wanting to get back to playing sports. Most folks after ACL surgery, especially when we use your tendon, your tendon or autograft tendon, and specifically the quadriceps tendon, or for folks that have cartilage or meniscus work, you most likely will be in a brace after the surgery that goes from your ankle all the way up to your hip. Now that brace, the first 2 weeks after surgery, we're going to want you in that pretty much all the time except to showers. And so we will teach you how to put that on and off the day of surgery, and the therapist can help guide that as well. Now for most folks, after an ACL surgery, the plan is to get you home. This is a surgery that is commonly done and most commonly done at our surgery center. We'll finish the surgery and allow you to wake up and then have somebody take you home where you'll start your recovery process. Now on the day of surgery, you will not be able to drive yourself. So let's talk about transportation plans. You will need a driver the day of surgery to get you to the facility and to take you home. And then for the next few weeks to month, we may have to adjust, or you may need to be prepared for transportation. Specifically, if it is your right knee that is having ACL surgery, it may take up to 4 to 6 weeks before you have enough control of your quadriceps and enough stability and confidence in your knee to safely operate a vehicle. If you have left knee surgery, typically you can get back to driving a little bit sooner, within a couple weeks. But in general, left knee or right, we usually tell you, you can return to driving when you feel safe, when you are not taking narcotic medications, and you're capable of getting in and out of a vehicle. Now for our patients that are a little bit older than our younger in-school athletes, after ACL surgery, you may also want to go ahead and prepare for a return to work planning. This surgery itself, although it is outpatient, the first few days and that first week can be difficult, especially getting around. If you work in a home or an office, a home office type setting, or simply at a desk, you may be able to return to a lot of work activities within the first week or two. However, if you have to drive yourself to work, or you work at an in-person office, or you have to go into work and you don't have transportation, it may take longer, up to 4 to 6 weeks, to return to light work activities or desk work. For higher activities, lifting, construction work, or jobs that require frequent walking, stairs, it can take up to 2 to 3 months after ACL surgery to return to those types of work without modifications. No matter what, you know what your job requires. And usually in clinic, if you ask about work, I will throw the question back to you and have you help us construct a note or a return to work plan. And on that note, I would advise that during the lead up to surgery, talk with your employer, talk with your HR department, find out what paperwork or what steps need to be taken to fill out FMLA paperwork if you need that done. My office can help coordinate that. Just talk with your job what you need, and we can help get that process sorted out. Now finally, we've scheduled surgery. You've made all these plans for home, driving, and work, and then we're up to the week of surgery. There's a few steps that are going to occur during this final week. Usually you'll get a call from one of the nurses or the staff at the surgery center. They're going to check in with you and make sure that you're confident about the date and that we've got everything approved and everything ready. You may also get a call from my office, especially if it's been more than a month since we last saw you. And we're going to set up a visit either in office or telemedicine with myself or my physician's assistant. We're going to update your history and make sure no new injuries have occurred. We'll review a lot of the plan as we've discussed in this video. We'll talk about your pain medications, anesthesia, the nerve block, and a lot of topics like this. This is also your final opportunity before the day of surgery to ask us questions. So write some of those questions down in preparation for that visit. All right, now we've made it to the day of surgery. Specifically the night before, we're gonna ask that you not eat or drink anything, usually after midnight, the night before your planned procedure date. This is just a safety issue for anesthesia. We want your stomach empty. We'll also ask that you arrive early the day of surgery, so coordinate with your ride. Most of the time, we're gonna want you at the surgery center within 2 hours or so prior to your surgery. Wear loose, comfortable clothes that's easy to change into after surgery. Bring all of your identification cards and insurance information, as well as any other medical notes that we've requested. Also, this is a final opportunity. You will see me the day of surgery and we'll discuss some things and I'll have an opportunity to answer some more questions if some more have come up. Again, we will confirm with you the surgery itself, the plan of repair and reconstruction of your ACL, and have final discussions about the type of graft we might use. And so this is your chance to ask more questions, and we'll finalize our plan from a surgical technique standpoint at that time. And finally, I would just ask for patience. Sometimes on surgery days, although we try and stick to our surgical times very closely, we get behind. And so we'll try and get you into the operating room as soon as possible. We know you're hungry and thirsty, and so we try and respect that and try and get it done safely, as safe and as quickly as possible.